अस्सलाम वालेकुम, वेलकम बैक टू माय चैनल। आज की इस वीडियो में हम डिस्कस करेंगे लोअर बैक MCQs। A 28-year-old man with chronic lower back pain came to your office for the renewal of his medication. He was injured at least 5 years ago while attempting to lift a box of heavy tools. Since that time, he has been off work, living on compensation insurance payments, and he is not able to find a job that does not aggravate his back pain. On physical examination, the patient demonstrates some vague tenderness in the paravertebral area around L3 to L5. He has some limitations on both flexion and extension. MCQ 1. Which of the following statement regarding chronic lower back pain is false? Approximately 35% of patients with acute lower back pain will develop chronic lower back pain. MCQ 2. Regarding the pathogenesis of lower back pain, which of the following statement is true? In up to 90% of cases of lower back pain, a definite anatomical or pathophysiological diagnosis cannot be made. MCQ 3. Regarding the treatment of chronic lower back pain, which of the following statement is false? Spinal decompression is a valid recommendation for the treatment of chronic lower back pain. MCQ 4. Which of the following is the most common cause of lower back pain is lumbosacral sprain or strain? Which of the following treatment has little support for its effectiveness in the treatment of chronic lower back pain is proliferation therapy. Problem 2. A 64-year-old man came to your office complaining of back pain and leg pain that is aggravated by walking. He tells you that the pain starts after he has walked 2 blocks. He gets relief when he is sitting or he is walking and leaning forward. Physical examination reveals pain and decreased motion with backward bending of lumbosacral spine. There is a negative straight leg raise test result and there is no neurological deficits. What is the most likely diagnosis is spinal stenosis. Which of the following is not indicative of inflammatory back pain such as ankylosing spondylitis, aggravation of pain with activity? Which of the following statements regarding the history and physical examination of a patient with lower back pain is true? None of the above statements. The positive predictive value of history in lower back pain is high. The positive predictive value of physical examination is high. The positive predictive value of radiological investigation for patients is high. The patient predictive value of serum, blood and chemistry for is high. All are true. None of the above are true. Which of the following characteristics of a history of mechanical lower back pain is relative acute onset, history of overuse or precipitating injury, pain was during the day? A, B and C are right. Which of the following is a red flag or danger sign relative to diagnosis of lower back pain is bowel or bladder dysfunction, impotence, weight loss, significant night pain? All of above. Which of the following statements regarding plain spinal radiographs of patient with lower back pain is false? Osteophyte formation in the intervertebral space is predictive of diagnostic disease, dichogenic disease. This is false. Which of the following statements regarding the use of CT or MRI scanning in the diagnosis of his herniation and spinal stenosis is false? CT scan is better than MRI scanning with regard to imaging of soft images. What is the most cost-effective and crucial aspect of the treatment of chronic lower back pain is patient education. Regarding the use of exercise in the treatment of chronic lower back pain, which of the following statements is true? Exercise allows patient to participate in their treatment program. Exercise should follow a graduated progression. Following the beginning of exercise program for lower back pain, a temporary increase in pain may occur. Stretching exercise are recommended in the initial exercise program. Isometric strengthening exercise follows. All of above. Which of the following statement regarding the treatment of acute lower leg pain is true? NSAIDs are effective for short-term symptomatic relief in acute lower back pain. उम्मीद है ये MCQs आप लोग के लिए हेल्पफुल रहेंगे. थैंक यू सो मच.